So cumulative lipid risk report. So we have a female presenting with dyslipidemia. She's 55 years old. So predisposing, causative, and contributing factors are either genetic or acquired. The primary causes are genetic, and the most common is familial hypercholesterolemia, where hepatic and intestinal epithelial cell uptake and catabolism of LDL cholesterol can be impaired by genetic defects in any of the proteins involved in LDL metabolism, and this results in elevated serum LDL cholesterol. So the most common genetic mutation is in the LDL receptor gene, and this accounts for 80 to 85% of cases. So the secondary causes are lifestyle and they're acquired. The second and the third is age and gender. Age in itself is correlated with increased risk of cardiac risk factors, including diabetes and obesity. However, an increase in LDL cholesterol is seen in women of postmenopausal age due to a decline in estrogen, which has a significant role in regulating mRNA production of the aforementioned proteins involved in liver lipid metabolism. So diet is the next one, where high intake of foods containing saturated and trans fats cause an imbalance in the LDL to HDL cholesterol ratio. And the next is BMI. So menopause causes weight gain due to estrogen decline and subsequent impaired lipid metabolism. This is indicated by a Myers BMI within the overweight category. And the next is insufficient exercise. So exercise enhances skeletal muscle utilization of lipids instead of glycogen, and that thereby reduces plasma lipids. So signs and symptoms, the first is arcus senilis, which is where accumulated lipid deposits in the eyes cause the formation of an opaque white ring around the cornea. The next is tendinous xanthomas, where cholesterol accumulates in joints or tendons. Xanthelasemia, where cholesterol deposits in the eyes form subcutaneous yellow-colored papules. And then we have dyspnea, which is where altered lung surfactant function increases alveoli surface tension and difficulty breathing. The next is acute pancreatitis, where excess chylomicrons and free fatty acids trigger pancreatic tissue ischemia and inflammation. And then the last one is paresthesias, where nerve myelinated fiber density loss causes a burning or tingling sensation in the feet or hands. So long-term complications, chronic unmanaged dyslipidemia leads to atherosclerosis. This causes low-grade inflammation and the gradual narrowing of the inner lining of arteries as the lipid deposits accumulate over time, forming a plaque. Eventually that plaque ruptures, triggering a thrombotic formation, which occludes blood flow. The location of the occlusion determines the nature of complications. So for example, if the occlusion occurs in arteries of the heart, it's referred to as coronary artery disease and can result in myocardial infarction. Whereas if reduced blood flow occurs in arteries of the brain, an ischemic stroke may occur. And then these are the references.